Hi, welcome back to Little Steps, Big Gains. My name is Elizabeth. Thank you for coming and sitting down and listening to this video called Let's Talk Balance. And this conversation originates 11 years ago when one of my very first patients asked me, what makes up my balance? And I'm embarrassed because I really didn't have much of an answer. So here we are 11 years later, and I have some more information for you. And so overall, balance is very complicated. So this is kind of a superficial overview with hopefully a little bit of depth at the same time of balance to give you some information on this area. Now, let's start with the three systems that make up your balance. The first system, this is our visual system that contributes to balance. My eyes, your eyes, give feedback to your brain of where you are in space. When you start to tip over, your eyes are kicking in. The floor is coming closer. You're tipping over. Respond, react. They've had people in these tunnels and looking at these almost like picture frames, these rectangles, looking at their balance, having them do movements, and then guess what? They tilted the frames, okay? So they tilt these frames and now they have them do these reaching activities and they're all over the place because of how much it changed their visual input of what their environment is, where they are in that environment. Now, where does this come to play in real life? When our vision is occluded, it can really mess with our balance, right? Because now you don't have that feedback. Late at night, movie theaters, bright sun, those are things that could trigger that. So an FYI to be careful in those areas. This is also why when I do balance training with an individual, I have them close their eyes because I say, let's take this to the next level. And I am next to them, okay? So please be careful here. I'm next to that individual and I have them close their eyes. And then suddenly they're swaying all over the place and they open their eyes and say, what the heck is going on? And I explain, for you individually, it appears that you tend to be visually dependent. You are using your eyes quite a bit heavily because of some other systems that might be weaker. So that's the visual system. The next system, number 2, hang in there with me, is our somatosensory system. And this is tightly linked, they're linked together with the proprioceptive system, which we've talked about in the introductory video. And I talked a little bit in my video about MS. And so here we are. This is basically your body's awareness of where it is in space. So if you're shifting one way or to the other, if I'm tipping back, the feedback in my heels tells my brain, you're falling back, respond. That's that system. Now, what are real life, real world applications? So this is where my residents come from the hospital and they have swelling in their feet, edema, and that fluid creates this barrier between the floor surface and then their plantar receptors, which are the receptors in your feet. Okay, so now they're walking and they're saying, where the heck am I? I'm walking on sponges. And so that is where that system might be impaired. Another situation is brand spanking new shoes when people come in and their families are amazing. Well, new shoes could be a problem if there's a change of barrier between the bottom of their feet. And there might be this getting used to, or maybe we need to do some balance training without them. So I'll also, with my residents, this is where therapists put people on these foam balance pads and suddenly they're all over the place again because we're taking away that feedback. Unfortunately, individuals that have complications with diabetes, such as diabetic peripheral neuropathy, when we don't have the same sensation down there or the feedback, such as with peripheral vascular disease as well, it could cause an impairment in this system. And they have shown that these individuals can have up to a 30% increase in sway because of that. Now, our ankles provide a lot of input to our brain based on the position that they're in as well. So there's a whole bunch of real world applications that come into our somatosensory system. This is just an overview. Hang in there with me. So we have our visual system. We have that somatosensory proprioceptive system. Now let's jump into the third system. This is the vestibular system. And I remember being years back with a therapist that was explaining the vestibular system to a patient, talking about the inner ears and these crystals that are with fluid in these canals. And I thought it was all outer space, but actually a very intelligent man. And the vestibular system is in the inner ear, and it sends signals via vestibular neurons to the brain that tell you where your head is in space, what's going on up here, and positional changes. Okay, if you've heard of the word vertigo, that is something that influences the vestibular system. And if you have an impairment in the system, I recommend seeking vestibular rehabilitation. A lot of doctors prescribe medications, which can have complications. So talk to your doctor about other options as well, not just giving pills, just to see. So anyways, as we age, those vestibular neurons do decrease in number. And so therefore this system can become hypofunctioning, which is why so many older adults are so dependent on the other systems, specifically the visual system, for that reason. Individuals with vestibular hypofunctioning are at a significant increase in risk for falls, up to 250%, is what one of my instructors was telling me. So where does this come into application with life, okay? Head turns. So you're walking down the mall, and you look to the left at a store and you find yourself like kind of tipping the opposite way. So head turns really kick in. Positional changes, looking up, you're showering, you washing your hair, and you look up to rinse, and suddenly you might feel dizzy or out of sorts there, pardon me. This is part of the vestibular system. And so where does this apply? Well, we should actually be very careful if this is a system that's hypofunctioning for you. Whenever you're doing things like head turns, looking around, you may need to take it slow, and you may need to do some what I call gaze stabilization, where when you look, you kind of take your time, let your gaze stabilize, instead of doing these quick looking around all over the place, because that could put you at a high risk for falls. With a few of my patients, what I do is I actually put tape all along their arm with all these numbers and letters. And we're walking, and I say third letter, and he has to look down and read that third letter, and we look up and keep walking. And a lot of it is teaching compensatory strategies about let's be safe, okay? Maybe you need to stop, look down, get, that information, pretend it's a watch, the time. Who wears watches these days? Okay, well, I do. Anyways, and then we look back up, and then maybe take that minute to stabilize your gaze. That would be a way to compensate if this area is very weak for you. Maybe eventually you're going to rehabilitate it where you're able to do that safely. But that is like a real life applications to the vestibular system. So guess what? Those are our three main systems that make up our balance. Okay, now there are other components. Weakness, right? So we've been doing in our 30-day standing balance challenge, where we're working on power when it comes time for, we're going very slow, working on the proprioceptive system, right? Very slow. When we're at that end range, we're using this max force with velocity to push ourselves back into place. And this comes into the real world. If you're starting to tip over, you absolutely need the power to propel yourself back to your center of gravity instead of keep going. So the power comes from, as we age, so there's two types of muscle fibers in your muscles. There are endurance muscle fibers, which are type 1, and power, which are type 2. And as we age, the type 2 muscle fibers tend to decline faster. But we need power for function, especially things like getting up out of a chair, right? We absolutely need power. So that's where power training comes in. And a big thing I have residents, my patients do, are power ups. So we're sitting in a chair and I say, give me power. 1, 2, power up, okay? And then sit down very slowly for that eccentric control, okay? And we sit down, give me another power up. Power. That's a great power exercise that I do with my residents. But power is something that tends to decline, and that can influence our balance if we're tipping and put us at a risk for falls. Posture is another big one, and we've been talking about this. If my posture is forward, now my whole equilibrium is off, and we get used to this position. Excuse me. So what happens when my residents, which this happens quite a bit, we're so used to this position, and I say, hey, let's stand up tall. And they're afraid, and sometimes people don't stand up tall because guess what? When they start to, they keep going and they tip back, and we're falling back. And so that is another thing that can really influence our balance, is our posture. So what do I do for my residents with this? I'm next to them, and this is where it's so hard to recommend exercises because you really need a spotter. But having something in front of someone where they're hovering, let's slouch, okay? Ugh, so bad. We don't want to do that, right? And then let's stand up really tall and practice getting our posture and our balance without tipping back as we go. And so we're practicing this, opening up, hunching over. I'm big on humor, so I say, hey, let's look sexy, right? And we open up with certain residents, of course. So anyways, that is a big thing that can inhibit somebody, is their posture, where our body becomes accustomed to certain positions as well. We're going to loop back to weakness, a big area. So there are 3 main strategies that we use when we start to tip over. The big one is our ankle strategy. When I start to tip back, guess what's kicking in? My ankles, to pull me back forward, right? If your ankles are very weak, that really inhibits you, or if they're unstable. So that is a big component of falls, is just the ankle strength alone. And a lot of therapists recommend, and I do this too, ankle joint strategy exercises. And this is where I can have people do what I call ice cream cones. And we shift our weight, guess what, into an ice cream cone. In other words, kind of like a circle. Once again, you really need a spotter, something in front of you to hover on. But all of our exercises that we've been doing with our standing, where we do our stepping, okay? And then guess what? We're rocking forwards, okay? Really lifting that back heel. Now this is a big one, rocking back and lifting that front toe, okay? We need our heel toe strike. When you're walking, if your ankles are weak and you're dragging your toes, it's going to get caught on the ground, and that's when we can face plant. Going along with this is my slipper story, okay? Slippers without backs are a big fear for therapists when we see those, because when you have a slipper without a back, you often don't lift your foot all the way up. And the reason being is if I lift my foot off the ground, guess what? My slipper flies forward, and I absolutely want to keep my slipper on. So for that reason, I don't lift my foot up, and I also want to keep my toe sliding along the ground to stabilize my slipper, okay? So slippers without backs can be really contribute to risk for falls quite a bit. So if you have slippers without backs, I recommend looking into someone's with backs behind them. And if you're struggling getting slippers or shoes on and off, I recommend Googling what's called a foot funnel. I love foot funnels, something to try out along with those long-handled shoe horns. Another story there. But anyways, so in terms of ankle strategies, really strong ankles is very important to balance. Another thing I have residents do is stand with their back towards a wall and something in front as well, and just shift your weight forward, and guess what? Shift it back. Try not to fall into that wall, right? Forward and back. And now you're practicing those ankle strategies and strength where something's behind you and something's in front of you. Now, if your balance is very impaired, I have to liability recommend that somebody's with you. This is a very difficult video to make recommendations for my safety, as well as your safety, both of us together. So we absolutely have to put our safety first. Another thing that puts us for risk as falls is our glutes, okay, those underdeveloped glutes that I keep talking about. And the glutes are that nickname for those 3 butt muscles that make up your butt, right? So those are the muscles that we absolutely need for posture when walking and when doing stairs. They're going to contribute to keeping us upright. But not only that, those glutes stabilize the pelvis. And if your pelvis is unstable, it could cause a tilting as you walk. But not only that, it's going to affect your entire lower body limb. So here you might be walking on an angle and that pelvis is not stable, and it can cause an abnormal heel strike or pressure down on those knees. And if you have pressure or pain, then you start doing a different gait pattern to compensate for it. So those glutes are extremely important, which is why we're doing so much glute exercises. Now, they've done these studies, conduction studies of how much recruitment you're getting of those glute muscles, the butt muscles. And guess what? They found very good results from people just doing butt squeezes. How crazy is that? It's so easy in the chair or in standing. And I actually will have people lengthen the glutes first. So I'll have them standing at a chair and I'll have them kind of lengthen by doing a hip hinge. And a hip hinge is where you stick your hips back by about 30 degrees, lengthening those glutes. And then guess what? I want you to stand up tall and squeeze them for me for about 10 seconds, okay? And then you can relax and give me that little hip hinge and lengthen them again. So butt squeezes are actually great. And sometimes we do all these complicated exercises like clamshells and all these things, which are phenomenal. Absolutely phenomenal. But butt squeezes are so easy and they can be done anywhere. And so I recommend recruiting butt squeezes a few times a day, 20 good old butt squeezes, holding for a good 10 seconds in the chair, standing up. Now, if any of these things cause you pain or if you have muscle spasms, maybe talk to your doctor first. Hey, can I squeeze my butt? No, but it's hard for me to recommend medical advice because I really shouldn't if I don't know you. But this is for the average person that just has plain old weakness down there, including younger people, even like me. And this is where throughout our exercises, we are recruiting those glutes throughout a lot of single leg stance when we're shifting our weight, lifting our opposite foot, and squeezing that standing leg. So when you do that stepping exercise with me, squeeze the glute of your standing leg as you go. And this is a lot of instructions. So please be patient. As you master it, then start to recruit those things. In our sitting program, when we were reaching to the opposite side, so when I was reaching my right hand to the right side, I was squeezing my opposite glutes. And you can kind of incorporate those as well. Okay, so maybe jump in the sitting program and start to recruit those in sitting instead of just doing your squeezes alone, which that's phenomenal too. So we can lose those glute strength, the glute muscles when they become underdeveloped, the ankle. Those are 2 things that we absolutely need for stability when we lose our balance for our ankle strategies, and then we lose our balance for our hip strategies. That third strategy, there's ankle, hip, and then stepping. And a stepping strategy is when you lose your balance and guess what? You step, okay? Hey, we need our power muscle fibers to stop us and then bring us back again. And that's where in our standing balance program, why we're doing it, it's kind of a modified plyometric. A plyometric is when you do things like jumps because you're using max force with speed, but we're not jumping here. And so that's where we're doing, where we're stepping and doing that push off. And that's where good old power ups come from in the chair. So those are a few things in terms of what makes up your balance, what is inhibiting your balance, and then what can I do about it? And I have a really hard time with that third section, but these are just some tips and tricks. And jump into our balance program. Real quick, this is a long video, but there are specific populations. I already talked a little bit about diabetes and the complications from diabetic peripheral neuropathy. With MS, when they've tested the conduction of the proprioceptive pathways, they have found a little bit of a latency there in terms of when there were perturbations or reaching. So if there's a latency there, that system might definitely be a big impairment for you, which is where Tai Chi comes in, is so beneficial. You can even Google Tai Chi outside of us, okay? Because Tai Chi is so effective for the proprioceptive system, being that these movements are slow. That's what challenges it. Fast movements don't really challenge the proprioceptive system because everything is so fast, right? Slow movements, mindful movements, that challenges the proprioceptive system. So for everybody, but MS, that's a great strategy for you because of the delayed responses there with those postural displacements. And then Parkinson's, I have videos specifically for you on things like freezing of gait. Unfortunately, with Parkinson's, there's a dopamine deficit. So we might be tipping back, which is very, very common. That's called retropulsion. And there's a latency in response time also. So we tend to keep going. And I have a video just for you as well. So this is a long video, but it's because it's a big topic. It's an overview of overall what makes up our balance, what we can do about it. I hope you found this informative, and I'm always open to feedback. I always include my email at the bottom of our descriptions. So thank you for sitting down and joining with me. I appreciate that for this whole video called Let's Talk Balance. I hope you jump in and look at some of the educational videos as well, because little steps when we work on these things can make some big gains.